What is gynecomastia? See, the gynecomastia is nothing but abnormal development of the female breast tissue in males. So normally, usually it happens between 13-14 years of the age, when there is a like the development maturity happens. That time the guys started developing a breast kind of a thing because excess of the estrogen in the body. Any non-surgical options to correct the gynecomastia? It is a very common question most of the people ask us, because nobody wants to go for surgery. For sure, even doctors, we are not wanting to operate on you unless otherwise there is no solution for you. There is a lot of drugs are tried in correcting the gynecomastia without surgery. Example, anti-estrogens and something called danazole, a combination of estrogen and danazole. A lot of things are attempted. So what most of the endocrinologists whom I discuss with them, they invariably agree that it reduces the size a little, and minimal stages probably might be happy, but usually the problem is after 6 months, 1 year follow up, they feel the recurrence rate again it comes back, or there is no further reduction. So it is not a complete solution for a gynecomastia. See, the gynecomastia person, what they want the flat chest, they don't want any gland inside. Obviously the non-surgical methods won't give you the results what you expect. Very minimal reduction, that too tends to recur after few months. And the only one symptoms what you will be benefited by the drug treatment is when you have the pain, persistent pain because of the glandular activity, the anti-estrogens might help to reduce the pain temporarily. So the mainstay of treatment till today all over the world is surgery only. Do you keep any drainage tube after surgery? This other question commonly people ask after the gynecomastia surgery. So lot of surgeons are comfortable keeping a drainage tube, but we don't keep the drainage tube. But both are correct. Okay, they are comfortable keeping a drainage tube, so their experience, their results are better with a drainage tube. But in our experience, we don't feel that necessity for keeping a drainage tube, and more than that, it's very uncomfortable to the patients. So it's not giving a great difference in my results. So I don't keep a drainage tube, and that's the only thing I can tell you. Both are nothing wrong. Keeping a drainage tube, you won't become a bad surgeon. Since I'm not keeping a drainage tube, I am not becoming a very good surgeon. It's each surgeon's comfort and their experience. You have to understand this. Is there any chance of seroma collection in gynecomastia surgery? So to avoid that, whether you need to keep a drainage tube. So usually seroma is extremely rare in our experience, and probably I have aspirated maybe 5 to 7 seroma aspiration in my 1900 cases. So for the 5 to 7 cases, I don't think we need to keep a drain to avoid it. Even the drains are not absolute way to prevent the seromas. So what we normally do is that proper compression will prevent you to accumulate the seroma in the underneath skin. So seroma is extremely rare. If it happens, simple needle aspiration will correct the issue. What are the complications you develop because of the gynecomastia surgery? Already want to explain that the seroma formation might happen in few people. Some people bleeding might be there. So only the restrictions. See, first 2 days rest, 1 week no driving the vehicle. These are all the restrictions to avoid the bleeding complications, because we arrest the bleeding point during surgery, but after surgery, sudden movement of your chest muscles will open up the bleeding point. So bleeding might happen. If that is the case, if there is a small bleeding, nothing to worry. Body will absorb on its own when you give a compression garment. But if it's a major bleeding, expanding, it's almost red everywhere, you have to come and meet us immediately. That's what I normally say. First 2 days, try to stay in the Chennai itself. So otherwise, after you go back, if you develop the hematoma, you will be in trouble. You have to go and meet a doctor there whom you don't know. They won't comfortable operating on you because you'll be operated by us. So this kind of a discomfort will happen. So first 2 days, stay in Chennai always will be safer. because 99% of the hematoma happens in first 48 hours only. It's very rare, but better to be safer. Another complication what you see normally is the superficial skin necrosis. We say that usually that areolar skin, what happens is it loses the blood supply. So the superficial part of the areola will peel off and it becomes white with the black dots in between. The black dots in between eventually spread and gives a normal color in 4 to 5 months time. So to patiently wait for 4 to 5 months to get the color back, the black color to spread. Some people, extremely rare, some people they won't get the color back. We always advise them to go for tattooing, black tattooing this area. The color is not important in this area, but still when you are removing the shirt it looks odd. So we need to match the remaining nearby colors and do the tattoo of the areolar region. Usually the tattoo has to be done after 6 months. And other thing what commonly people see is there will be a mild discrepancy between the right and left side, asymmetry between the right and left side. It's very normal. So the idea of none of us have the symmetrical face. If you take the right and left side of the face, lot of difference will be there in each. But after surgery in the chest, your expectation is you want a perfect looking chest in both the sides, symmetrical chest. But it won't happen because your right and left side muscles itself is not symmetrical. Even if you give a proper sculpted chest, some people healing time, it won't be symmetrical. The idea of the whole surgery is when you are removing the shirt in front of others, nobody should look at your chest oddly. Okay, that's the only idea of the whole surgery. You should have a sculpted chest. There will be a mild asymmetry that is acceptable. When there is a more, not acceptable asymmetry, we'll take you back and we'll correct it by surgery. Okay, that's extremely rare. Very mild discrepancies, better to avoid it. Even you are so particular about it, ask us. Sometimes mild injection treatment will help us to make it symmetrical, and non-surgically we can manage to the extent. If it is not, we will do the surgery for you. What is the anesthesia you use during gynecomastia surgery? We do it in general anesthesia because it's comfortable for you and for as well as for us. And in minor cases like only gland is there and the affordability is the issue, we opt for a local anesthesia in few cases that is extremely not comfortable to the patient. So as much as possible select general anesthesia. In major cases like grade 2, 3, 4 and all, we can't do it under local anesthesia. It's extremely painful to you. When I do a liposuction on your chest going over the rib cage and all, you feel extremely uncomfortable. That's the reason we opt for a general anesthesia. Not like earlier days, general anesthesia is very dangerous. Like now all short acting agents, very improvised that Boyle's machine, and each and every thing it detects during surgery. So my anesthetists are extremely good. So I don't worry about my anesthesia or anesthetist techniques. So you can boldly opt for the general anesthesia, that is better for you. Both the chest look symmetrical after surgery. This is a very common question I come across with a lot of people. So usually your right and left side body build is completely different. Even if you take the face, your right and left side won't be symmetrical. For that reason, even after the surgery, you might feel the mild differences in the right and left side chest. So what you need to expect from the surgery: flat chest and sculpted chest with the muscle definition well expressed, and almost symmetrical chest. Okay, that's what you have to expect. See, when you remove the shirt, if other person commented that you have a problem, then it needs the secondary correction. Even our patients, sometimes even 100 patients if I operate, 2 patients come for a mild secondary corrections. Some people they need only a mild injections to correct it. Some people we need a surgery to correct it. So unless otherwise gross asymmetry, we don't do surgery for the mildest asymmetries. We try to manage it non-surgically to understand these things. Can I do the bodybuilding after the surgery, after the gynecomastia surgery? So we do surgery between the skin and the muscle. Okay, we don't damage the muscle. We don't even damage the fascia over the muscle. So your muscle is not disturbed at all. In very rare cases, mild muscle injury will happen. That is even common after your chest workout. Okay, so don't worry about it. So you can hit the gym after 45 days and from the time of surgery, and you can do the start with the milder workouts, milder weights, then slowly increase the weights like day goes by. So a lot of my patients are doing the bodybuilding, they are going for the competitions. A lot of actors, they are doing a heavy workout to build the muscle. So don't worry, you are very normal. After surgery you can do whatever kind of exercise you want after 45 days. Sir, I want to undergo the gynecomastia surgery. Is there any problem during my sexual life or post marriage? Any other concern? This is not the patients ask commonly to me, usually the parents ask this to me often. See, we do the surgery between the skin and the muscle. Okay, we are not doing any changes internally. There is no relation between your sexual life and this gynecomastia surgery. You have to understand this. You have to make your parents understand this. Okay, their concern, yes, obviously we can understand, but there is no relation at all. As long as your hormone levels are normal, you have a secondary sexual character developed, your broad, your like beard and the mustache development is normal, your body hair development is normal, your erections are normal. Obviously, you need not worry about your marriage or sexual life. I have gynecomastia. Whether it is mandatory to go for surgery? Obviously not. See, it's not a clinical problem, like it's not a disease. First of all, understand this. It's only for the cosmetic reasons we need to operate on you. Some people say that, sir, if the breast tissue is there, I will develop cancer in the future. Yes, you might, but if you see all the women, if they have a chance of getting a cancer in the future, they are not removing the breast. Understand that this way. If it happens, we'll address it. Doesn't mean that you need to go for a surgery for just for concern about the cancer. You got it? So you need not go for the surgery unless otherwise you are psychologically worried about this issue or you feel ashamed of this. Definitely not a mandatory surgery at all.